ma'am. I'm Rochelle De Vera from BSN 2A Group 2. And today I'm going to demonstrate the application of moist heat or the compress and Sitz bath, and also the application for the cold therapy. And for the purposes for the application of moist heat, we have first to relieve of muscle spasms and also the decreasing of joint stiffness. Second is to stimulate circulation, thus promotes healing. Third is to reducing inflammation or edema. Fourth is the extensibility of the collagen tissues. And last is to provide relief and comfort like hemorrhoids. So for the application, the purposes for the application in the cold therapy, we have first is to slow or stop the bleeding. Second is to slow the bacterial activity in clients with infections. Third is to reduce the swelling in the injured tissues, including the sprains and fractures. Fourth is to control the pain and fluid loss in the initial treatment of burns. Fifth is to prevent peristalsis in clients with abdominal inflammation. And last is to prevent escape of heat from the body by slowing the circulation, which also relieves congestion. And now let's proceed for the preparation for the application of moist heat. So first is for the assessment. First, we need to identify the patients using at least 2 identifiers. And yes, we have the right patient. And then we need to refer for the healthcare provider's order for the type of moist heat application, location, and the duration of application, and also the desired temperature and the agency policies for the temperature. And then we need to perform hand hygiene. So let's say for instance that I wash my hand or use a sanitizer or alcohol. Then after that, you need to assess the skin around the part to be treated, and you can also you need also to assess use the neurovascular assessment for the sensitivity for the temperature and pain. And next is you need to refer for the patient's medical record for the contraindications for the moist heat application. So after that, you need to you can also inspect for the wound, for the size, color, drainage, tenderness, and odor. So after inspecting the wound, you can assess now the patient's blood pressure. So let's say for instance I get the blood pressure of our patient, and then also the pulse. After the pulse, you can also assess for the patient's mobility and level of comfort, and also the patient's and the family members understanding for the application that you are going to do, and also for the other safety precautions or factors. So now let's proceed for the planning. So in planning, first thing to do is you need to identify the expected outcomes, and also you need to assembled and prepared all the equipments and what you call this one, or the materials that you are going to do or you are going to use for the application that you are going to do. So now you can also explain to the patient the steps for the procedure that you are going to do, and also the purposes. And also you can describe the sensations for how the patients might feel, and also the precautions for to prevent burns. And now let's proceed for the implementations. So first thing to do for the implementation, you need to provide the patient's privacy. So if you are in the room, make sure that you close the door, and if there is a curtain, you need to close the curtain. And next thing to do is you need to position your patient in bed and keep the affected body part in a proper alignment. And you need to expose the body part, to be treated. And also you can also drape your patient as needed. And then you need to perform hand hygiene and put your gloves on. And now that I wash my hands and put my gloves on, you can put waterproof pad under the patients if it is appropriate. So now we are going to put the waterproof pad. So let's say, for instance, this is the waterproof pad. We are going to put it under our patient, but you need to consider the location of the wound of your patient. As my patient wound is on his wrist part or arm part, so I'm going to put this waterproof pad under my patient's arm. So I'm going to put this one, and then by applying the moist sterile compress, we need first to heat the solution that we are going to use on its proper or desired temperature. And next is you need to prepare the aquathermia and then put it or set the temperature if you are going to use it or if needed. And then after that you can you need to remove the dressing of your patient or the dressing on the wound of your patient. So as you can see, there is a dressing on the wound of my patient, so I'm going to put it away. And after removing it or undressing the wound of your patient, you need to assess the wound and also the skin surrounds the wound. So after assessing the wound and the skin surrounds it, you need to dispose the dressing of the wound of your patient and with your gloves, and you can dispose it on the biohazard bag. So let's dispose it. And then you need to perform hand hygiene. So you can wash your hands again or use alcohol or sanitizer. And then we need to prepare our compress. So first thing to do is you need to pour the solution or warm solution inside the basin or any container that you are going to use, and you can use aseptic or sterile. You can use a sterile technique if needed. There you are. There you go. So that is the warm solution. So now that we poured the warm solution inside the basin or any container, now we need to open the gauze. So here are our gauze. And also you can use a sterile technique if needed. So we open our gauze, and then you can add this gauze in the solution inside the basin, and you can need to use the proper aseptic technique. There you are. Then we need to dispose this. And then we need to follow the instructions for warming using a commercially proper compress, and then we need to apply again or put again a sterile or clean gloves. So now we need to pick one layer of our gauze and wrung out the excess solution, and then put it on. Then you can apply it to the wound of your patient, but you need to avoid the skin that surrounds the wound. So you need to apply it. So I'm going to apply it now. Is it okay? Okay. And then you can lift the edge of the gauze for assessing if there is a redness. So there is no redness. And then after that, you can pack the gauze snugly if the patient tolerated the compress, and you can cover all the wound with the compress. So this one. So I'm going to put this on your wound. You can still tolerate the temperature, sir. Is it okay? Okay, sir, thank you. And then after that, you can cover the moist compress with a dry sterile dressing and bath towel. And also you can pinned or tied it in place. So, sir, I'm going to put this another one. Is it okay? You can still tolerate the temperature, sir? Okay, sir, thank you. And then after that, you can dispose or remove your gloves. So, dispose it. And you need to do a proper hygiene. So you can wash your hands or use a alcohol or a alcohol. And then you can apply aquathermia, heat pack, or waterproof heating pad over the towel, and then keep it in place with desired or for the desired duration. And you can change the warm compress using sterile technique as ordered if the pad or the heat pack was not used. Then you can apply also clean gloves again. So, and then now you can remove the pad, the towel, and the compress. So, sir, I'm going to remove all of this one. And then after removing it, you can replace dry sterile dressing. So, sir, I'm going to dress your wound. You can use the tape. So let's say, for instance, I dress the wound of our patient now. So next is you can help your patient for the comfortable position. Sir, are you comfortable now? Okay, thank you. And then you can dispose all the equipment that you use, like your disposable gloves, and dispose it. After disposing it, you can perform hand hygiene. You can wash your hands or use alcohol or sanitizer. And for the evaluation, first thing we need to do is to inspect the condition of the body part or the wound for the evidence of healing, and we need also to observe the skin color, temperature, edema, and also the sensitivity to touch. And then we need to ask our patient to describe the level of comfort, and we can also ask about any sensation of burning following treatment, and also we can obtain vital signs and compared with the baseline. Then we can also ask our patient to demonstrate the on how to apply compress at home, and we need also to identify unexpected outcome. So for the recording and reporting, first we need to record and report all the pertinent information of the procedure, and also we need to record the pre-procedure and post-procedure vital signs, and document all the evaluation of the patient or the caregiver learning. And for the application of the code therapy, so for the implementation, first thing we need to do is to provide the privacy of our client or patient. So if you are in the room, make sure that you close the door, and if there's a curtain, you need to close the curtain. And next thing you need to do is to perform hand hygiene. You can wash your hands or use alcohol or a sanitizer, and then put the gloves, clean gloves or sterile gloves. And then you need to position your client properly, and you can expose the area to be treated, and you need to drape the client with blanket. Sir, are you comfortable? Okay, thank you. And then after that, you can put a towel or pad under the area where to be treated. So, sir, I'm going to put this towel under your arm. And by doing that, for the application of the cold compress, first thing we need to do for the preparation for that is to put a cold water or ice water to the basin or to your container. This is a cold water. And then you need to test the temperature. Yes, it is cold. And then after that, you need to open the gauze and put it or submerge it to the cold water or inside the basin. And dispose this one. And then you need to wring out the excess moisture or solution, and then apply the compress to the affected area of the patient. And you can also remove and re-moisten and reapply it to the client to maintain the temperature as needed. So, sir, I'm going to put it again. Is it okay? Okay, thank you. And by applying ice pack or bag, first you need to fill the bag with water to secure the cup and inverted bag. And then you need to empty the water, and then fill the bag properly with ice chip and water. But I have here the ice tube. And then put water. And then you need to make sure to close the bag, and then you need to express the excess air to the bag, and then make sure that you close it properly, and then wipe the bag dry. You can use this one. That one. And then after that, you can squeeze and kneaded the bag or the pack commercially, and after that you can wrap the pack or bag with the towel, and then apply it to the part to be treated or at the injury, and you can use tape as needed. Is it okay, sir? Thank you. And for the guidelines for applying a commercial gel pack, first thing you need to do is to remove the gel pack from the freezer, and then you need to wrap it in a towel and apply it to the to be treated part of the client or patient or the injury, and also you need to secure with tape or gauze as needed. And for the guidelines for the applying electrically controlled cooling device, first thing you need to do is to prepare the device appropriately, and then ensure that all the connections are intact and the temperature is set. And then you need to wrap the cool water flow pad in a towel or pillowcase, and then you need to wrap the cool pad around the body parts to be treated, like this one. Then you need to wrap it, and then you need to turn on the device on and set the correct temperature that you are going to use, and then secure secure it with the elastic wrap, like bandage or a bandage roll, I mean gauze roll, or you can use a ties. And then now we need to remove our gloves and dispose it properly. So we need to dispose it. And then we need to perform hand hygiene. And then now we need to check the condition of the skin at its appropriate intervals. And we can use extra caution if the area was edematous, and in that we need to assess the site more often. And also we need to stop if the patient is complain of the burning sensations or the skin began to feel numb. And then we need to apply, or we need to put clean or sterile gloves again. And then we need now to remove the compress pad, or the compress or the pad at appropriate time, and we need to dry any moisture. And then now we need to help our patient in a comfortable position. So sir, let me help you. Okay, sir. Are you comfortable, sir? Okay, thank you. And then we need to dispose all the supplies that we used, and also we need to empty the basin. And we need also to dispose the soiled linens and also our gloves. And we need to perform hand hygiene. You can wash your hands or use alcohol or sanitizer. And for the evaluation, first thing we need to do is to inspect the affected area for the integrity, color, temperature, and sensitivity to touch, and be re-evaluated at appropriate interval. So, and then we need to palpate the affected area for edema, bruising, and also bleeding. And then we need to ask our patient to report the pain level, and ask the patient to demonstrate how to apply ice pack. And we can also need to identify the unexpected outcome. And for the reporting and recording, first we need to record the procedure and patient's response in appropriate log, and document the evaluation of patient or the caregiver, caregiver learning. And we need also to report any sensations of burning, numbness, or unrelieved skin color changes to the healthcare provider.